The RWJF Awards for Health Equity program is a 7-year program initiated in 2015. The awards program recognizes and celebrates individuals who have successfully implemented systems changes to reduce health disparities. 9 organizations have been selected to administer the program. Each of the grantee organizations shares our vision for building a culture of health and achieving health equity in the nation. The winners are dedicated, amazing individuals who are pioneering game changers in the work that they do to develop and implement solutions for achieving health equity. Our award winners' stories share several themes: community engagement, partnerships, risk-taking, and thinking outside the box.
So much of our programs are really, once again, sit at the intersection of mental health and social justice. It's something we call healing justice. And healing justice says that you cannot talk about mental health without talking about racism. You cannot talk about it without talking about misogyny. You cannot talk about it with transphobia, homophobia. All those things have to be in the conversation. The unique ways in which different people experience psychological distress or experience like distress from the broader culture are influenced by their gender, their race, their class, identity, those pieces. And so when we talk about equity in the context of the mental health and healing justice work that's going on in this country, we have to let clinicians, healers, folks know that that needs to be a part of the conversation.
I think culture determines health, perhaps, at least some of our research indicate, could be even broader than the social determinants of health. Culture still jumps out as a greater predictors of health outcomes, more than the social determinants of health issues. A lot more research needs to be conducted in these areas, but I think we shouldn't necessarily think of one or another, but rather thinking about this concept of social and cultural determinants of health much more comprehensively.
My take on health equity for my Crow people is that for them to have the opportunity to gain awareness, because awareness is powerful. Like when a Crow woman just realized that she can go in and have a pap test and not end up with cervical cancer, that was powerful. Just a little bit of basic knowledge from someone that they know and that they feel that cares about them. They went in and had the pap test.
In a rural setting, in a rural county, a lot of seniors don't have access to the resources that maybe other seniors do of more means. And so this program was very specific to those 100 seniors, and over a 1-year time span, what we uncovered was we were able to not only impact the rehospitalization rate, we decreased it by 57%, but also a 15% decline in the total spend. So the total Medicare dollar that was getting spent decreased by 15%. And their overall healthcare status improved.
West Virginia Health Rate's mobile dental program and mobile harm reduction program has taught me and our entire community that change is sometimes necessary, that you can't always do it the same way that you've always done it, that sometimes you need to look at things new, different, unique. You know, we're all creatures of habit, but looking at this, it's made people be more innovative and look at different ways to serve people, different ways to meet need. You can't always be egocentric, you know, set up a clinic and come to me. You have to think about going where the need is.
As a change agent, I don't always ask permission. I sometimes don't even ask for opinions. I just keep knocking on doors until someone answers. I don't stay local. I knock on national doors. I don't stay within the confines of housing. I knock on education doors or health doors. I partner and I look for the connections with my colleagues. And when they see the connection between their work and my work, and we go in as a combined voice, all of a sudden we are now louder and more effective together.
We use housing as an anchor, but it changed so many things as an economic development opportunity for residents in the community who were entrepreneurs. It changed the image of people that the people had. You know, we no longer had 11 lots of blighted land in our community. We had transformed with $13 million of investment the land. We had created a marketplace that is an amazing marketplace where people gather on a weekly basis just to connect with one another. And so we really changed the perception. We really changed the neighborhood, the actual grid of the neighborhood. But we also, importantly, were able to celebrate our cultures and celebrate, you know, our community as a place that you want to come and visit.
So truly, transportation is a pathway to health, and not just a metaphor, but it is. If we want people to be able to live a healthy lifestyle, they have to be able to move around the community in a safe and reliable way. And that means they need to be able to get to a job. They need to be able to get to medical appointments, to preventive services, to access to healthy foods, to their children's schools, to be able to support their families. So we really think about how people move in our community, and especially not always thinking of the automobile being the first option.
Our traditions are related to health equity because they address the trauma in the spirit. A lot of Western methods only address the physical, and sometimes therapy doesn't really work for us. We have to have a different method to address the spiritual aspect of our trauma. Some of the girls have their own personal traumas as well as the trauma of their parents and their grandparents, whether it be sexual abuse, physical abuse, as well as our tribe. We've had a long, hard history, and sometimes that history can't be addressed by Western methods.